Yeah, hi. My name is Professor Frank Chinegwundoh MBE. I'm a consultant urological surgeon based in London. Today, I'd like to talk to you about erectile dysfunction. So, erectile dysfunction, otherwise known as impotence, is where the man is unable to get an erection, or if he gets an erection, it is short-lived. And this is a cause of distress to many men. It's more common with age, but we are seeing younger and younger men developing erectile dysfunction. Now, there can be a whole variety of causes for a man's inability to get an erection. I'll just mention some of the risk factors. So, for example, diabetes, hypertension, that is high blood pressure, men who've had cardiac disease, for example, men who've had a heart attack, or men who have angina. There are a variety of medications, a variety of drugs that can cause erectile dysfunction. It is also more common in men with renal failure or men with certain neurological diseases, for example, such as Parkinson's disease. There can be psychological reasons, or so-called psychogenic erectile dysfunction that can lead to a loss of erections. Probably the commonest group that would be referred to me are men with what we call organic erectile dysfunction. In other words, they have some sort of disease process, for example, diabetes. Now, there is a lot that we can do for erectile dysfunction, and I always tell the men that come to see me that we can deal with this. Depends how far you want to go and what lengths you're prepared to go to restore your sex life. So when I see a man, of course, I'll take a careful history. I will examine the man. In the history, for example, I might be asking if the man has had recent pelvic surgery. So men who've had a radical prostatectomy for prostate cancer, for example, many of them will experience erectile difficulties. Or men who've had an operation on their bowels, where the surgeon has been in the pelvis, where the nerves that affects the penis originate from. So taking a careful history is important. I will examine the man. I will examine the penis, the groins, the testicles, to see if we can find a reason for it. See if we can find something that we can change. I will also send the man off to have some blood tests, particularly testosterone, because some men, as they age, the testosterone reduces below a normal level, and that is associated with erectile dysfunction. I will also check that the man is not diabetic. At times, we make that diagnosis of diabetes where the man hadn't suspected that. We will check the kidney function, the so-called blood test of urea and electrolytes. Again, we can often detect a man who's got renal dysfunction, even though they had been unaware of it. So there are certain blood tests that we do following the physical examination. However, what I really want to focus on is what can we do about it. Now, there are a category of men where the erectile dysfunction is clearly what we term psychogenic. In other words, there's a psychological reason for this. And if we suspect this, then I would refer the man onto a psychosexual therapist to try and tease out what could have precipitated the erectile dysfunction and put measures in place to try and get around that. If I think it is not a psychological reason, or for example, depression or anxiety, then there are more physical ways of trying to restore the man's erections. The simplest way is by taking a tablet. There are various tablets such as sildenafil, tadalafil, avanafil, levitra. These are tablets that you can take on demand 1 hour before you anticipate having intercourse. The important thing to say about these tablets is that sexual stimulation is required. I always have a bit of a laugh with the man. I'll say, if you take a tablet and you sit down and watch Match of the Day, and after the 1 hour you expect things are going to work, that's not going to happen. You have to have sexual stimulation, whether that's foreplay or whether that's masturbation. Tablets work probably for about 6 out of 10 men that I would see with erectile dysfunction. If the tablets don't work or the man has side effects from the tablet, then what else can we do? Well, there is a cream that you can apply to the head of the penis called Erexon. You rub the cream in, and within 30 to 60 minutes with sexual stimulation, you may get an erection. There is also a drug in the form of a small pellet. It's called Muse, that's M-U-S-E, that you can insert down into the water pipe through a special applicator, and then you rub the penis, and that dissolves inside the urethra, and that can cause an erection. Some men don't want any pharmaceuticals at all, and for them we have what we call a vacuum pump. A vacuum pump is essentially, it's a hollow plastic cylinder that you place over the penis down to the pubic hair, pubic bone area. You pump the air out of it, and that causes blood to go into the penis to make the penis rigid. You remove the cylinder and place a specially designed rubber ring down to the base of the penis to keep the blood in the penis. Then after intercourse, you remove the ring, and then the penis goes back down. We also have injections into the penis. There are various drugs that you can inject into the penis, and the man can be taught very easily how to do this. So, for example, there's alprostadil injections, there's Envicorp injections. And what the man does through a very fine needle, so it's virtually painless, the man is taught how to put injection of a drug, perhaps 20 to 30 minutes before anticipated intercourse. And this works very well for most men. So where I would say the drugs have a success, maybe 6 out of 10 men, the injections are more 8 to 9 out of 10 men. What if the injections don't work, or the vacuum pump doesn't work, or the Muse doesn't work, or the gel doesn't work, and the tablets don't work? Is there anything we can do to rescue these men's sex life? Well, the answer to that is yes. It's possible to put in what we call a penile implant. So it's possible to have surgery whereby we implant this device into the penis, which can be activated or deactivated according to whether the man wants an erection or wants to deflate an erection. There's various types of these prostheses. There's malleable, there's inflatables, but the message is there is always something that can be done to restore a man's erections and lead to sexual satisfaction, whatever the cause of that erectile dysfunction may be.